Hello and welcome back to Curry Soup. Today we're going to be talking about 5 signs to watch out for in kidney failure. I chose this topic today because a lot of patients were never ever aware that they were having symptoms of kidney failure, or some of them didn't even know that they were at high risk for kidney failure. Hopefully after knowing all these 5 symptoms, you could watch out for kidney failure better. Just a small introduction of kidney before we go straight into the topic. Kidney is an organ which is about this big. All of us have them, we have 2 of them. But the important thing to note about the kidney is if both kidney fails and you don't get either regular dialysis or a transplant, a new kidney transplanted into you, it is impossible for anyone to live. So I hope knowing all these 5 signs will keep you a step ahead of kidney failure. So without wasting any more time, let's get straight into it. The first sign of kidney failure is frequent urination or polyuria. And this situation is even worse if you have something called nocturia, which is increased frequency in urinating at night after you fell asleep. The reason for this is because the kidney's function is to filter the blood, sort of like filter the blood, get rid of all the toxins in the body through the urine. When the kidney starts failing, its function drops as well, the efficiency drops as well. So when this happens, every time it filters, it's not concentrating enough urine inside the bladder, so we're not excreting enough of whatever we're supposed to excrete out of our body. So when this happens, the kidney will have to filter the urine again and again so that all the toxin in the body is removed. That's the reason why people who are approaching kidney failure often have frequent urination as one of the symptoms. So if you have frequent urination, check with your doctor. Sign number 2 is bubbly or frothy urine, meaning when you're urinating and you're looking at the urine, it looks like you just poured some carbonated drink inside, like Coca-Cola or something. So much bubble and the urine is so foamy. The reason for this is protein leak. When a kidney is damaged, its function is not as good as it used to be, obviously. So when this happens, it'll start leaking protein inside the urine, which is not supposed to be inside the urine. When this happens, when there's high concentration of protein inside the urine starts getting bubbly and very foamy. So if you have any bubbly urine or foamy urine, it's best to go check with the doctor as soon as possible. Sign number 3 is leg or ankle swelling. Sometimes our leg will swell if we stood up too much or we walk too much, or one of these reasons. But if you have no reason to have a swollen ankle and your ankle is swollen, it might be a sign of kidney disease. To check, there's a very simple method. At your ankle, just use your thumb and press down for 2 seconds. And when you let go, if the skin goes back to normal immediately, you're okay. But once you let go, if there's a dimple there, the skin didn't come back to normal, then that means you're having leg swelling, you're having ankle swelling, and it's time for you to check up with your doctor. There are multiple reasons for this. Some of it is because of sodium filtering problem, but the most obvious one that I could tell you is because the urine is in charge of filtering the blood, correct? So when the kidney doesn't filter and excrete out what it's supposed to excrete properly, whatever is left is retained back in the body. So the body has sort of like a fluid overload situation, and these are the fluids which are staying in the leg now. This fluid retention can cause a lot of other problems as well. Some might even have shortness of breath, meaning they're almost like having an asthmatic symptom. They cannot breathe properly. This is because all those fluid which are supposed to go are now in the lungs. Because of that, they'll have difficulty breathing, coughing, and shortness of breath. If you have any leg swelling or ankle swelling, it's best that you go check with your doctor as soon as possible. Sign number 4 is bad breath or bad taste in the mouth. People with kidney failure or kidney disease often have sort of like an ammonia smell coming out from their mouth, and this will also give them sort of like a metallic taste inside the mouth, and because of this they often have bad breath. And this also relates to symptom number 5, which is loss of appetite. Because of the metallic taste in the mouth and this weird smell, mostly they won't feel like eating at all, because whatever food you put in your mouth, the taste is going to be changed. It's going to taste very weird and very disgusting. This would lead to loss of appetite, and eventually they'll start losing weight. So if you have a bad breath, or you have a weird taste in your mouth, or your appetite has dropped considerably without you doing anything, it's best to go check up very soon, because all these might be signs of kidney failure. The 2 main causes of kidney failure is diabetes and hypertension. So for a lot of patients, this kidney failure could have been prevented completely if they had only known what the signs are and the risk factors for getting kidney failure. So I hope you learned something from this video. Watch out for kidney failure and stay healthy. If you learned anything in this video at all and you found it valuable, the only thing I ask you to do is to share it with a friend or a family member. Spread the knowledge. If you haven't subscribed, go ahead and smash the subscribe button down there and click the bell icon. YouTube's algorithm is changing all the time, and we want to make sure that our videos come and reach you. So until the next informative video, in anything you do, do your best and be the best version of yourself. Bye bye.